X-ray vision instantly. It's like I can see the structures, right?
For injectors, a keen understanding of facial anatomy is essential for providing patients with safer and more effective treatments.
We learn a lot of anatomy in books throughout our careers, but this has been a really good experience into translating the books into real life.
That's why the Academy for Injection Anatomy Advanced Cadaver course, created by Dr. Chris Surek, takes practitioners beyond the lecture. With hands-on cadaver dissection, injectors can see how product interacts with every layer of their client's space.
Just seeing how close I am to the artery was kind of like bone chilling.
I do not believe that any injector should be practicing on a live patient until they actually are able to dissect a face and look at the anatomy.